Welcome to the deep dive. You've brought us some really thought-provoking stuff lately, looking at these systems. Systems meant to help, but sometimes, well, they backfire a bit.
Mm,
Today, we're diving right into something potentially surprising, maybe even a little frustrating, the business of poverty in the U.S.
exactly. We're looking at this piece by Johnny Harris, and it really puts a spotlight on this whole area. The main idea, we spend over $1 trillion a year on poverty programs.
A trillion.
Yeah.
Yeah.
But a big chunk of that, it doesn't go straight to the people who need it. It
That,
flows through private companies.
yeah.
That's the core insight, really.
hmm
Aid itself has become an industry.
Right, an industry. So in this deep dive, we want to unpack that. How does it actually work? We'll look at specific examples from the article, kind of dissect the mechanics and see
Mhm.
what the impact is. The goal is just to get some clarity on what sounds like a really complex system.
Definitely.
So maybe start with a bit of the history. The article touches on how we got here.
Sure. It points back to the 60s, the war on poverty.
Mhm.
Back then, you had these big direct government programs, Medicaid, Medicare, food stamps,
Right, direct aid.
and the article notes they actually made a difference. Poverty rates went down. But then things started to shift.
Okay, let's talk about that shift. The article mentions the 80s, Reagan, and this big push towards privatization.
Yeah, the argument was efficiency. Private companies could run these welfare programs better, cheaper than the government.
I put the idea. Anyway,
And it really picked up steam under Clinton. States got federal money, but then they'd hire private firms to manage benefits, check eligibility, that kind of thing.
the insight being, market solutions for social problems.
Exactly. But the question the article raises is, did that promise of efficiency actually, work out?
Mm-hmm.
Because what happened on the ground, as the article shows, was often, well, quite different.
Okay, so let's get into the first case study then, tax prep, Liberty Tax and the EITC.
Yeah, the Earned Income Tax Credit. It's meant to be this really important boost for low-income working families.
A helping hand, basically.
Right. But, and here's the catch, the U.S. tax code is incredibly complex, like bafflingly complex, according to the article.
Okay.
And that complexity, it creates an opportunity. Companies like Liberty Tax step in, saying they'll help people navigate it.
Right, makes sense.
But the article and lawsuits later suggest their main focus wasn't really helping as much as making a profit.
Ah, so the insight is that complexity, even in a system designed to help, can be exploited.
Precisely. Exploited by intermediaries.
Mhm.
Sometimes, at the expense of the people the system is supposed to benefit.
What kind of practices are we talking about?
Well, the article mentions predatory stuff, skimming fees off refunds that were already small,
Oof.
and really pushing these high-interest anticipation loans.
Which are basically,
Very short-term loans against your refund, but with super high interest rates, often totally unnecessary if people just waited a bit for the actual refund.
wow.
And the article contrasts this sharply with other countries where getting similar credits is simple, like a few clicks online.
So it makes you ask, who benefits from all this complexity here?
That's the key question, isn't it? It seems like complexity can be weaponized, almost, used to extract value instead of just providing support.
Which kind of leads us into the next example, right? Housing vouchers and rent inflation.
Yeah, Section 8 vouchers. Instead of the government building lots of public housing, the idea is to give people vouchers to help them afford rent in the private market.
Okay. Sounds reasonable in theory.
It could be, but the article highlights a big problem. Landlords know the government's backing these vouchers,
Mm-hmm.
so they have this incentive to jack up the rent, way higher than the normal market rate.
Ah, okay. So the insight there is government money entering a market without tight controls can just inflate prices,
Yeah.
benefiting the landlords more than the tenants.
Exactly. There's this example from D.C. in the article. An apartment normally worth, say, $1,600 a month was being rented for $2,500 just because a Section 8 voucher was involved.
Wow. That's a huge difference.
Now, when you scale that up across a city or the whole country, the article says it costs taxpayers millions extra every month.
Without actually creating more affordable housing or necessarily better quality housing.
Right. The article calls them fake markets. Government money just flows to landlords, and voucher holders might even get trapped in overpriced places because they don't have other options.
Okay, so we have complexity being exploited, subsidies inflating markets. What's next? These corporate middlemen.
Yeah, companies like Maximus. The article singles them out. These are private companies hired by the government to run huge parts of the welfare system, things like Medicaid management.
Maximus is big.
Oh, yeah. A $4.9 billion business, the article says. And because they're a for-profit company, their main driver, well, it's
Yeah,
profit,
naturally.
which the article suggests can lead them to prioritize cost-cutting, sometimes in ways that hurt people, like delaying applications for benefits people desperately need.
So the tension is between the company's need for profit and the government's goal of, actually helping people.
That's the core conflict. And the incentives can get really skewed.
How so?
The article mentions cases where these companies get paid based on the number of people they remove from benefit programs.
Wait, remove, not help.
Remove. Think about that incentive. They make more money by kicking people off aid.
That seems completely backwards to the whole point of welfare programs.
It really highlights how messed up the incentives can get when you bring private companies into social safety nets this way. And the article is careful to say these companies aren't necessarily, like, evil. They're just acting rationally within the rules of the system they're in.
So the problem is the system's design, the rules themselves.
It seems that way.
Yeah.
The fundamental issue might be the system and the incentives it creates.
Okay. And the article gives more examples of how these incentives play out, like Medicaid dentists.
Yeah, that's another disturbing one. Some dental clinics focus almost entirely on Medicaid patients, and the way they get paid often encourages doing a high volume of procedures.
More procedures, more money.
Exactly, which, tragically, can lead to dentists doing unnecessary work, fillings, root canals, whatever, even billing for things they didn't actually do.
And often on vulnerable patients who might not know better.
That's the implication. The insight is that a fee-for-service model, especially without strong oversight, can incentivize overtreatment, even fraud.
That Cool Smiles example was shocking. A $24 million settlement.
Right?
Something like 17 root canals on one toddler.
It's just, yeah.
Mhm.
It really shows the risk when the system rewards quantity over quality or medical need.
Patient well-being takes a backseat to profit per procedure.
It seems that way sometimes. And the next case, dialysis clinics, shows a similar, really troubling dynamic.
Right, this one really got me. So the government pays for dialysis for kidney failure.
But it doesn't always cover kidney transplants as readily.
Yep.
And here's the really perverse part, as the article puts it. Dialysis centers get paid per treatment each time someone comes in for dialysis.
So,
Yeah.
wait, if a patient gets a transplant, the dialysis center loses that recurring income.
Exactly. So there's very little financial incentive for the center to push hard
Right.
for a patient to get a transplant, even if that's the best thing for their health long term.
Keeping them on dialysis is better for the clinic's bottom line.
That's the cold logic the article points to.
Yeah.
The insight is stark. A payment model focused on ongoing treatment, not a cure, can actually discourage the best outcomes for patients.
And the article links this to higher death rates, fewer transplant referrals.
Yeah. And Moden mentions companies like DaVita facing over $1 billion in settlements for unethical practices related to this stuff.
$1 billion. It's staggering. The idea that keeping people sick can be more profitable.
It's deeply uncomfortable. It forces you to question the structure of healthcare for these populations.
And the last example, foster children's Social Security. This one felt just incredibly dark.
I agree. This one is. It's really hard to wrap your head around. So foster kids with disabilities or whose parents have died, they're entitled to Social Security benefits. Maybe $700 a month, something like that.
Okay, money meant specifically for these very vulnerable kids.
Yes. But here's the twist. States hire companies, Maximus again is mentioned, not to help the kids get the money, but to identify which kids are eligible so the state can take that money and put it into its own general budget.
They, what? They take the kids' Social Security money.
The state diverts it, legally, apparently.
Uh,
The insight is just, wow, federal aid meant for specific vulnerable individuals can be legally rerouted by the state.
and Maximus gets paid for finding these kids at a
Oh.
finder's fee.
Around $1,600 per child identified, according to the article.
That's heck.
And it lists states Alaska, Washington, Wisconsin, Illinois taking tens of millions combined. Money meant for abused, abandoned, disabled kids.
And the kids or their guardians might not even realize this is happening.
Often not, it seems. It's just staggering. The safety net itself is being used to prop up state budgets, and private companies profit from facilitating it.
It really forces you to rethink the ethics of it all. Deeply concerning.
Absolutely.
So, okay. We've seen these really troubling examples. Does the article offer any way forward, any potential solutions?
It does suggest a few things. A multi-pronged approach, really. First, maybe halt further privatization until we really understand the full costs and scope. Just pause.
Okay, take a...
Second, bring back competition. Where these contractors have monopolies, Introduce alternatives.
Because lack of competition reduces accountability, lets them get away with more.
That seems to be the insight. Less competition, less pressure to perform well or ethically. More room for, well, for profiting off the system itself.
Makes sense. What else?
Clear performance standards. Treat these companies like utilities, almost. Judge them on the quality of service, the outcomes for people, not just saving money.
Right. Focus on the mission.
And critically, limit the profit motive, especially in healthcare, like with dialysis, where the incentives seem particularly prone to becoming perverse. And finally, government needs to change its role, not just handing out contracts, but being a really demanding customer, holding these companies' feet to the fire, making sure they're actually serving the people they're supposed to.
So active, rigorous oversight is key.
That's the underlying point. Effective oversight is absolutely crucial if you're going to have privatization and social welfare.
The article sums it up pretty neatly, doesn't it? Something like,
Yeah. There is a version of privatization that works, but only with strict oversight, clear metrics, and robust competition.
So it's not saying privatization can't work, but the way it's often been done here, it's created these massive problems.
Exactly. Loopholes, distortions, allowing exploitation.
Okay. So wrapping this part up, this deep dive really brings home a central, kind of disturbing point. The U.S. welfare system, in many ways, has become this incredibly complex machine
A web, yeah.
where companies can make a lot of money from poverty.
And that often hurts the very people the system was set up to help.
You've been listening to The Deep Dive. We've just unpacked the business of poverty in the U.S. based on Johnny Harris's investigation. Now, we want to turn it over to you, our listeners. What stood out most from these examples? When you think about systems designed to help, does this change how you think about the incentives involved? What questions does it raise for you?
And maybe that leads to the final big question the article leaves us with. Is this current model, this privatized welfare system, is it really serving the most vulnerable people effectively? Or are there fundamental flaws in how it's structured? Flaws that need serious fixing for a more ethical and effective approach. You might want to check out the full Johnny Harris article. We've linked it in the show notes. It's worth a read.
Thanks for joining us for this deep dive into such a critical and, complex issue. We hope it gave you some valuable things to think about.